looking at the face of a woman who had fast-moving breast cancer that could take her life, I just could not understand how the people who were testifying for the insurance industry could sleep at night as people, as individuals. How could they defend this policy?
I remember there was one moment in the hearing where somebody on the panel actually asked, does it bother you that people are going to die because of these policies?
Doesn't it bother you that people are going to die because you insist on reviewing a policy that somebody took out in good faith and forgot to tell you that they were being treated for acne? Doesn't that bother you?
Yes, sir, it does. And we regret the necessity that has to occur even a single time.
There were three heads of insurance companies at this hearing: Don Hamm of Assurant Health, Richard Collins of United Health's Golden Rule Insurance Company, and Brian Sassy of WellPoint. And it seemed like they'd all been advised, like a lot of corporate guys are in situations like this, not to give an inch on anything. They would not admit, for instance, the premise of the hearing, that they go looking for people to throw off their rolls in order to save money. At one point in the hearing, Congressman Stupak pulled out a list of 1,400 medical conditions that, if you have an individual policy with WellPoint insurance, trigger WellPoint to investigate you, looking for some way to cancel your policy.
Diseases ranging from heart disease and high blood pressure to diabetes and even pregnancy. So what do these conditions have in common that would cause you to investigate patients with these conditions for a possible rescission?
I would say there's no common theme other than these are conditions that, had the applicant disclosed their knowledge of a condition at the time of initial underwriting, we may have taken a different underwriting action.
So in 1,400 different areas they lie? The applicants lie? Or is it really a cost issue? These are 1,400 expensive areas, aren't they?
Yeah, rescission is not about cost.
According to the subcommittee's investigation, between the years 2003 and 2007, these three companies saved at least $300 million through the use of rescission. The insurance company's defense of rescission came down basically to two ideas. They have to fight fraud if they're going to give decent benefits to everybody else. And rescission is rare.
Rescission affects less than 0.5% of the people we cover.
During 2008, we rescinded only 0.1% of individual policies that year.
Our use of rescission is rare, less than 0.5% of all individual insurance policies.
Here's what those percentages mean in practice. The subcommittee's official report notes that at least 19,776 policies were rescinded between the years 2003 and 2007 by these three companies. They say at least in the report because United Health failed to provide data for 2 years, and WellPoint wouldn't provide data from all of its subsidiaries. Toward the end of the 3.5-hour hearing, after lawmakers made these three executives sit and listen to people who used to be their own customers, who their own companies had rescinded policies for, even though those people never tried to deceive the insurance companies about their health, like Robin Baton, the woman with cancer, Congressman Bart Stupak boiled everything down to one simple inquiry.
Let me ask each of our CEOs this question, starting with you, Mr. Hamm. Would you commit today that your company will never rescind another policy unless there was intentional fraudulent misrepresentation in the application?
I would not commit to that.
How about you, Mr. Collins? Would you commit to not to rescind any policy unless there's an intentional fraudulent misrepresentation?
No, sir. We follow the state laws and regulations, and we would not stipulate to that.
What he's saying is state laws allow us to do it this way, and we're good with that.
How about you, Mr. Sassy?
No, I can't commit to that. The intentional standard is not the law of the land in the majority of states.
Can I ask, were you surprised that none of them would commit to this?
Oh, no, I wasn't surprised. It doesn't surprise me, one, that they would say, well, the law is on our side.
And when you guys go into these kinds of hearings, do you go into them hoping to get the companies to go on the record and say in a moment like this that they're going to change their policies? Or do you just want to get them on the record being obstinate and unsympathetic?
Well, I guess the answer really is that such a heartless policy of these companies does need to be put on the record and contrasted with the real people who are hurt so badly by those.
And so the idea is, let's get these guys up here and get them to show America that they're not going to change unless we push them.
Exactly.
There came a point where one of the Republicans on the panel, Representative Michael Burgess from Texas, who's a doctor, said to the companies, "Look, I'm on your side. I'd like to help you guys, but I can't help you out if this is how you're going to be."
And I would urge you to think creatively about this problem, because this is the difficulty that leads us to where we are here today. And I can't help you.
Okay, questions or speeches are over.
If you're not willing to move on this issue.
Do you feel any sense of hope that the companies will come around and want to work with you? Do you have any moment, have you had any moment privately talking to the companies where you've thought, like, okay, well, maybe?
No. I think that we just have to make it against the law for them to do it. They've had their way with us for decades, and here we are in this terrible mess where they want to insure only healthy people. And, you know, if you're unlucky enough to get a serious disease or have an accident, then good luck.
Congresswoman Jan Schakowsky of Illinois. She went straight from our interview to a markup of the House health bill. She told me that she believes that rescission is something that is so hard to defend, something that is so clear-cut, that she thinks it's one of the things that Congress is going to be able to outlaw in whatever kind of health reform we end up with.